Dr. Vanita Rattan, and this channel is dedicated to skincare for skin of colour. As you know, I'm a doctor, but I'm also a cosmetic formulator specifically for skin of colour. So a lot of you watched my assumptions video, and I discussed having my Botox and fillers done to restore myself as I age. And Dr. Zoya is the one who does all my work for me. So a lot of you asked about Botox and fillers. We've just shot a full video on fillers. So make sure you head over and watch that video if you're interested. And this one is purely on Botox. So if that sounds good to you, please give me a thumbs up. Right, so let's get started. Right, so what is Botox?
So Botox is actually the trade name of botulinum toxin A by Allergan, but it's said colloquially now, Botox is just, the word everyone uses. It's actually a prescription-only medication, so you can only get it by a doctor, prescribed specifically for you. It's used in the NHS for multiple different indications, including migraines, sort of bladder issues, spasms, but there is obviously the cosmetic benefit of it to help reduce fine lines and wrinkles. So botulinum toxin A is a very interesting ingredient, essentially, or chemical, that how it works is you inject it into a muscle, and it works by blocking or competitively inhibiting certain receptors. And when it does that, your intrinsic receptor, so your acetylcholine, isn't able to then force that muscle to contract. The Botox is there instead. So then what happens over time, over the course of 2 weeks, is that muscle then starts relaxing, and then in so doing, your fine lines or deep wrinkles will also relax in that area.
Yeah, okay. So I had Botox done in my forehead, and initially I went somewhere else, and I think we used too much Botox. And what happened is, especially if you're really expressive, if you've got a face like mine where your eyebrows are constantly up in your head and your face is doing lots of different crazy faces, and you can't do it. It's a really strange sensation, and it felt like, for me, that I couldn't express myself. It felt like I wanted to raise my eyebrows, but they wouldn't raise. And so my face suddenly my eyebrows just became very flat.
And heavy?
And heavy, it felt heavy, but maybe what I actually realized is, because at the time I obviously started assessing everybody else's face, and I suddenly realized that nobody raises their eyebrows as much as I raise my eyebrows. Do you know what I mean? Like, even now, like, eyebrows are like flat, and mine like.
I try not to move it too much. I don't want to start having to need too much.
This is it. I think everyone else is smarter than me, and no one else moves their eyebrows. And so actually I didn't like that feeling, and so it wore off after a while. And when I went back, I came to Zoya actually to do it this time, and I told her I don't like the feeling that I can't raise my eyebrows. I have to be able to express myself, but also I don't really want to have deep furrows, because crinkles lead to wrinkles, and that's not what I want for my face. So you put a lot less, didn't you? And closer to my hairline.
Yes, exactly. So essentially with Botox, there's a big spectrum. So you can go for the classic frozen look, the one that makes all the headlines, the one that we look at celebrities and sometimes think, oh my God, what's going on? Yeah. Or you can go all the way on the other end of the spectrum, and you can have enough Botox or toxin put in the area to help reduce the lines, but still maintain movement. Yeah. So when you have a muscle that's been relaxed, other muscles will then compensate. So we have lots of opposing muscles. So if you have one muscle that's pulling and one muscle that's pushing, if you relax the pulling one, then the pushing one will then take over a bit more. So that's essentially probably what happened with you.
Yeah. Okay, so next question was, what is a right age to start Botox, and is it too late to start in your 50s?
So I wouldn't say there's any right age to start toxin. I think it's very much just a case of when you start noticing what we call static lines. So we've got static lines and dynamic lines. So dynamic lines are lines that form when we're moving our face. So when we're frowning, raising our eyebrows, that's normal. You get lines when you do that. But if those lines then remain when you're relaxed, that's when I would say it might be time to start thinking about, doing something about it, if that's something that you're concerned with. So, you can go from, retinols and things like that all the way to Botox. And you can do a type of Botox called baby Botox. So baby Botox is essentially doing a very small quantity to relax the muscle and reduce the appearance of the fine lines, but still maintain movement. But also you're then preventing that line from getting deeper. So the key thing is prevention. So if you're not allowing that muscle to move as much, it's still going to move, but you're not allowing it to move as much, those lines aren't going to get deeper and deeper and deeper. Therefore, you can put less Botox in if you start slightly earlier when you see a few lines, and then you can maintain your movement. But if you start getting it done, say in your 50s, when you've got deep static lines, that's when you just need to flood the area with Botox, and people end up being frozen, people end up with their eyebrows up here, and it becomes less of something that you're in control of in terms of how much movement you want, how natural you want it to look, because you're chasing the line as opposed to chasing a type of look, which is the natural having movement type of look. So I think I wouldn't wait, if it's something that concerns you, I wouldn't wait until your 50s. I would wait until the retinols or the topical creams aren't quite cutting it, and you want to get something that's going to just remove or reduce the appearance of the lines and prevent them from getting deeper.
Yeah. So probably once you start seeing static lines, just right at the beginning is probably, you want to do it all before that.
Yeah, when, if you've then started trying some topical agents, so certain creams that can help reduce those lines, and if you're finding that it's not really working and it's bothering you, then you can start then.
Botox the next step. Perfect. So how frequently do people need to get their Botox? How quickly does it wear off? What are your thoughts?
So in terms of how often people need to get their Botox done, essentially it depends on which area you're getting treated. So you can treat a number of different things with Botox. So I already mentioned some of the more medical indications, but in terms of the cosmetic side, the most common area to treat is your upper face. So the three areas, so your forehead lines, your frown lines, and the lines around your eyes. So there's a set of muscles there that all work together to keep your eyebrows where they are. That area, you've got lots of small muscles. So the amount of toxin you put there, you need to put enough that you get the result that you want, but you don't want to completely eradicate movement and cause any undue problems with the eyebrows, etc. So the amount you put there is small, so therefore it only really lasts 3 to 4 months. But what we find with our patients is that if they're regular Botox doers, then it lasts longer and longer each time, and I think that's just because the muscle's getting a little bit weaker. But again, we don't really do tons of Botox in anyone, so we don't really tend to see that frozen look. So I think people do find that it just lasts them a bit longer because the look they're trying to chase isn't one where they have no movement at all, so they still have movement. Therefore, they can go a bit longer.
Right, because it's just natural. It just carry on being natural. Right.
Yeah.
Absolutely. Does it hurt?
So with Botox, most people, I would say probably 75 to 80% of our patients find it completely relaxing. Some even say they really like the feeling.
Wow.
I don't know. But I would say some people find it quite stingy, because it is stingy, but it's very quick. I mean, I could do a whole upper face Botox in less than a minute.
Wow.
But I don't think any patient could handle that, so I wouldn't. But you could do it that quickly. But it's not really generally a painful treatment.
Okay, fine. And do you usually bruise after Botox?
No, not at all, because we're placing the Botox quite superficially, and again, knowing the anatomy of the different vessels, you can avoid vessels, and the anatomical landmarks for Botox, you don't really tend to bruise. It's very rare.
Okay. Is there anything that people should think about before they get Botox done? Anything they need to be concerned about or think twice before they actually proceed?
Yes, I mean, there's certain medical contraindications. So if you've got certain muscular disorders, neuromuscular disorders, then definitely you cannot. If you suffer from dry eyes, sometimes that can be exacerbated. If you've got particularly dry skin as well, we'll probably just say, let's get that under control. So any active skin condition in the area, we would say, let's just wait and sort that first. So those are the main things to think about. The other thing is, it's not a permanent solution. So it's a temporary measure, and it's about understanding whether financially you do want to continue with this. If you want to just try it once and see if you like it, and if you don't, then you don't go ahead. But if you do, then just understanding, how is it that you're going to continue doing this, and if is it something that you want to come every 3-4 months to get done.
It's a good question.
Mm.
That's a really important question because it isn't cheap. Let's talk about how much it generally costs or what the
So
price range is.
So I think in London it can go anywhere from, so the 3 areas, the most common areas to do is 300 plus for most areas around London.
So say you do it 3 times. How many times a year would you do it?
So I'd say most people would come maybe 2, maybe 3 times a year.
3 times a year.
Yeah.
So you're looking at about £1,000 a year. So it's not cheap. It is expensive, but you should know that before you probably take this journey, because otherwise it's a waste. Like you said, it's temporary. So you need to be fully aware of that before you.
But there are some conditions. So that there's where people have got large muscles here, or bruxism, teeth grinding essentially, or they just have slightly wider jaw and they want to slim it down just because they've got quite large muscle here. You can do Botox in that area, and that helps slim down the jawline, but also it has the sort of medical benefit of improving bruxism or teeth grinding.
Yeah.
So that treatment, because it's a larger muscle, it takes a lot more toxin.
Yeah.
So where you've put a higher dose in, it lasts that much longer. So that one can last up to 6 months even in some people. Okay. Same with areas in the neck. So some people get the turkey neck where they get lots of those lines. We call them platysmal bands. Yeah. You can relax those, and that can last up to 6 months too. Underarms. Yeah. So it works completely differently for a condition called hyperhidrosis or excessive sweating. Yeah. So essentially what happens there is it's a completely different mechanism that the Botox is working on. So it's not working on the muscle, it's working on the sweat gland, and it just blocks the gland from excreting sweat essentially, and so that just blocks it off for 6 months as well. So it varies in different areas that you treat.
Sure, so there are different things that's used for different things, absolutely. I think the last question I'm going to ask is, can you wear makeup the next day, and are people going to know the next day that you've had something done?
So Botox, pretty much, I think immediately after, what happens is you'll get these few little tiny bumps on the skin that we call blebs, and they most commonly just disappear within 20 to 30 minutes. I've never really seen it last much longer than that. So after that, people might see a little bit of redness in the area, but again, that settles down within a few hours too. So the next day, for sure, no one should be able to tell that you've had anything, because it takes 2 weeks for you to see the full effect, because you need to allow the muscle to really integrate with the Botox, or vice versa. And so it takes 2 weeks, but in terms of how it looks, straight after, a few bumps, bit of redness maybe, and then I would say most commonly an hour to 2 hours later, no one should be able to tell you've even had it. And then makeup wise, again, if you've had needle penetrating skin, you want to just avoid any makeup for at least 5 to 6 hours afterwards.
So hopefully next day, I think, probably best. Super, thank you so much, Dr. Zoya. Really appreciate that. She's been absolutely wonderful. We really picked her brain on 2 videos. If there's any other videos you want me to make sure you write them down below. We're both going to be in the comment section for 1 hour at the launch of this video and the filler video. So please just feel free to ask your questions. There's no judgment, and it's better to ask and get honest information rather than hearing from anywhere else. So please feel free to write down your questions down below. Don't forget to download your free ebook for skincare for skin of color. The link is down below too. And thank you very much for watching.